Hi, and welcome to Tony Time. I have a very special person on my show today, Helena Qualey. Helena, well, we go back 30 years. I knew her when she was born.
So now everyone knows my age. Thank you.
Oh, I haven't introduced you yet.
Sorry.
Shush. You know? No, she lived with me for quite some time, and when she was younger and she'd be with her father, she had the most amazing mother and father. Fran, Danny Qualey. Helena, welcome to the show, honey.
Hi. Thank you for having me. I'm so glad that I finally get to be on the fabulous Tony Time.
I'm glad you're here too. We're going to talk about, our show's going to be about cystic fibrosis today. Helena had a lung transplant, double lung transplant. She's at her 5-year anniversary, and that's something to go through. That's something that a lot of you out there may be getting ready for surgery. Some of you might have been diagnosed with cystic fibrosis, but I felt it's very important for you to hear what she has to say in her story and what she has gone through. Helena.
Hi.
My love.
Yes.
She's been a big part of my life, and I'm very, very grateful for it, and I love you very much. But let's talk about
Yes.
when you were first diagnosed with cystic fibrosis.
Well, I was diagnosed kind of late in life for a CF patient. Usually you're diagnosed early on, infancy. I had other health problems when I was younger. So I wasn't diagnosed till I was about 8 or 9.
Right.
And my symptoms were fairly mild at that time. It wasn't.
What were your symptoms?
Just a lot of coughing. It seemed I kept getting bronchitis all the time. I was at, the family pediatrician, it seemed every 6 weeks, and would go through antibiotics and then get sick again. So finally, doctor at NYU said, she should go up to Columbia Presbyterian in New York, get tested. Went through a whole bunch of tests, borderline on a few of them for cystic fibrosis. I got tested for tuberculosis, even HIV, because I had blood transfusions when I was younger.
Sure.
And finally, they did genetic testing, and that's when they found out that I indeed did have CF.
So this is a genetic.
Yes. Parents are usually carriers.
So Fran and...
So my mother and father were both carriers. They didn't have the disease, but they
Right.
had the gene.
Okay.
So you have a 25% chance of having a child with CF, 50 that they're a carrier, 25% that they don't have the disease or are a carrier. I was the lucky 25%, that got it, but and then so when I was diagnosed, there really wasn't a lot of treatment out there for CF. There was just one nebulizer treatment that it came out right when I got diagnosed that was specified. Everything else that the treatment was for asthma,
Right.
COPD, just to keep your lungs open.
What year was that about?
Well, let's see, I was
Ballpark.
8 or 9, 92, 92,
Okay.
93.
Getting a,
yeah.
kind of a frame of where.
It's not there. It's not many years that there's a lot of CF-related treatments or procedures or things like that. But there's so many in the pipeline now to help with patients and survival rates and things like that.
So as the time went on, you were diagnosed at 8. A lot happened through your life all the way. You were basically living a childhood, normal childhood, so to speak.
It was. I felt healthy. I did normal things, but if I got sick, I had to go to the doctor immediately. I
Right.
was a high risk for certain things. I'd have to get what we called tune-ups.
Yeah.
Go in the hospital every year, but that was just kind of a part of life when you're that young.
True,
It's just what you go
true.
through. And because I didn't feel that sick, it wasn't something that occupied my life all that much.
No, it did.
Everybody else's, the adults in my life, were a bit more frightened by it than I was.
Well, yeah, we all were. But um, Helena's family has a house here in Maine,
Yes.
so she lives in New York, um, and she'd be coming up here during the summer.
Hmm.
And you'd see her. She'd run around on the beach. She'd sit in the sun. Never, I mean, normal life, so to speak,
Life,
except
normal.
when you got a cold and you really got a cold.
Yeah.
And then as we kind of go through your teens and we fast forward, she did have a lung machine to shake.
It was a PT vest
Okay.
that used compressed air. You put it on, and it shook you like a little doll. And um, it was one of many things that was to try to shake up and get the mucus that was in your lungs to loosen up so you can get it out. So because that's what really caused the infections and the problems
True.
that CF people have, along with the inhalers and the nebulizers and the pills, IV treatments if I needed to have them. But airway clearance is pretty much the number one thing that
Sure.
will keep you as healthy as you can be.
Now tell me, through this time, can you kind of look back and think how you thought of this when you were in your teens?
I hated it. I thought it was just, I didn't really feel like it was doing anything at the time. You're a teenager, you just think, I can do anything. I can go anywhere. I'm not really, how sick am I really? Um, because you just,
Well,
when you're a
do
teenager, you feel invincible.
well, true. And were you kind of like in uh, denial mode? Um,
I think it was denial. I think it was I didn't know enough really kind of about it as much as I tried to read.
and you did read a lot because I know you were always on the computer reading the updates on CF.
Yes.
You did do that. I know
I
you
did it a
did.
lot.
Yeah.
But, when I was first diagnosed, we didn't have the internet to go on and read.
No, no.
So I would go into Barnes and Noble and read up the medical dictionaries. And, the only scary thing I knew was that they said the life expectancy at the time I was diagnosed was about 30. So, but again, you're like,
Well, you're
what do they
young.
know?
Yeah, you really don't think about it as
No.
much because at that point in time,
You're worried about high school boyfriends,
yep,
shopping, going to the movies, that kind of stuff. You had a life.
yeah.
Um,
But I mean, you lived your life. I mean, you went out there, you lived your life, you pushed. I know you pushed.
I pushed.
She pushed. I mean, she could be sick. No, 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 I'm okay. She'd start coughing. No, 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 I'm okay. But then we come down to when the doctors told you you had to have a lung transplant.
I was about 22. Well, I was about 22. I got a very bad case of pneumonia. Put me in the hospital for several days, out in LA, actually. And I never recovered from it. Really just took a toll on my lungs. And the age of 23, when I went out to Seattle, moved out there, saw a doctor out there that said, you might want to think, you might have to get this done. And I'm like, am I really that far along that I have to get this done? And they give you a little pamphlet. But still, I was like, all right, this is some time off. And then a few months later, my lung collapsed. And then they were like, all right, well, we got to get you on the list now. And it happened very quickly. It was like that.
You were on the list.
I was, yeah. Well, it takes some time to be put on the list. You have to go through, screenings for stuff, and there's a lot to be.
Kind of break that down a little bit for our audience.
Sure. Well, once they to see if you're a candidate, you have to know if, if there's any underlying problems that you have. They do blood work. They do psychological screenings. They do all sorts of things to make sure that you are a fit candidate for transplant. You have to be sick enough to have it, well enough to recover. And so once that happens, which takes some time, you're put on the list. And depending on the severity of your illness and age and things like that, you end up on the list in a spot, and then you do the waiting game, which is
Now, yeah, and at that time you were in your early 20s.
yes, I was 23. when I was put on the list.
Okay, so then from that point, you kind of knew you were going to do a lung transplant.
Yeah.
Mindset at that point.
Every day was on your mind, and every phone call revolved around it. Every phone ring revolved around it. Because you'd be woken up in the middle of the night, afternoon call, hey, we got lungs for you, which is kind of how they say it.
Which you only had, what, 3 hours to get to the hospital?
That's the minimum amount that they, well, I mean, give or take. So people that live far away from their transplant center, if they happen to live, they usually relocate.
Okay,
I mean, I was lucky I didn't have to
right.
move anywhere. I was already there by chance. But yeah, it's, they call you up and you got to go.
So from the time they put you on the list, from that point, how long did it take before you got the first call?
8 months.
All right, so that was 8 months of something hanging over your head, thinking,
Yep.
okay, every time the phone rang, every time something happened or you came down with a cold.
Am I going to make it to that call?
Yeah,
Because I was very sick at that point. I was on oxygen 24/7. I really, my quality of life wasn't really, for 23 years old, I couldn't go up and down stairs.
no.
I
You had
couldn't
a
walk
port
my
line.
dog. Yes.
Okay, now explain to the audience what a port line is. A lot do know, but
A port. A port's basically kind of like an internal IV.
yeah,
That can be accessed all the time. It's a central line that goes to your heart that can be accessed so you get medications, for people that, I was getting IV medications, seemed all the time.
right.
And my veins just couldn't keep up with the pokes. You
True.
can take blood from it, things like that. So I still have it, actually. Ooh,
Yeah,
the mic.
don't touch the mic.
Don't touch the mic. I still have it. Um, and it comes in handy. But I mean, a lot of people, cancer patients have it that, get their chemo through it. It's just something that saves a lot, from your peripheral veins and stuff like that to go through.
Okay, so now you're on oxygen 24/7. 8 months, you're waiting for that call to come in. You're waiting for, I'm sure nerves were on edge.
At times, there were a lot of nights where it's you banging your head against the wall, and cry yourself to sleep and
Oh, sure.
start to think about the what ifs and what this means. It was hard for me to think that, in my case, someone was gonna have to not, it's gonna have to die
Yeah,
for me to have a second chance at my life, which is very hard. That's why there's a mental.
yeah.
You have to be, you have to kind of accept that
It's a very difficult thing for a lot of people to do.
it is. And I was lucky though. I had a lot of friends and family that were very, you know, made that, turned into like, that person's life is their life and you have to,
Mm-hmm.
but it's still something you always think about.
Oh, yeah. Now, the first phone call, 8 months, came in.
Yes. About 2:30 in the afternoon, I was at the computer. I got off the phone and my husband at the time, I was like, all right, well, we got to go. You go up there and I was nervous. Didn't know really what to do. And I'm a person, I need to know what to do.
I know.
I need to know that how to go with it. But I made it all the way to the pre-op room. And my surgeon came out and grabbed my hand and said, lungs are no good. He said, we give them to a 65-year-old with emphysema. He says, they're not good enough for you. He says, I told you I was going to pick a pristine pair of lungs. And I was sort of relieved because I was like, at least I know what I'm doing now, so next time I got this. And then I'm like, wow, he really is looking at the lungs.
Mm-hmm.
They really are paying attention. They're like, oh, here's,
Well,
give
they're
them to
not
her.
just saying, here's a pair of lungs.
Exactly. It was,
Yeah.
so then, you pack up, go home. And then a month later, I was out, Friday night, something like that. Got a call, and I went into my friends. We gotta go. My lungs came in. Crying. But I was a little bit better. Went up there. It was kind of late at night, so we were waiting there, and I was exhausted at this point. I was too tired to cry at that point. Then they put the little hat on you, and they wheel you in, and this big room and lights, and then
You're gone.
you're gone.
Now, explain to the audience, too, about, Steve brought up a good point. donation of
Yes.
how that works? I mean, it's not like they're going to take everything out of you and
No, there are so many myths about donations. One that was literally brought up yesterday by Steve.
yeah.
One was, well, if I'm a donor, they won't save me if I'm in an accident, which is completely false.
Okay.
You know, the transplant team is not there in an ER situation. Um, and you're not declared dead by anyone from the transplant team. Uh, Chances are they're not even there, and it's not allowed.
Yeah.
Um, and also, the fact of being a donor might not even happen until that happens. The family might come in afterwards and say, you know what, we want to use them for donation. It's not like you come in there, people think if it's on my license, that's not true either.
Right, right.
And like in my case, I was in a region where there were several states involved.
Okay,
You
now
know,
how does that work? I mean, your
there's about
lungs.
9 or 10 regions in the United States. Like New York has its own regions because of the population.
Okay.
Seattle is the transplant center for, I don't remember the region number, but like people in Alaska and Hawaii would go there. So like they have to relocate.
All right.
I believe my transplanted organ came from Oregon. So there's no way that my doctor in Seattle and the doctor in there's just no way that that would happen.
Yeah.
People think, oh, well, they'll just harvest everything out of me and I'll look a mess. And even if that's not true either, it's a medical procedure. It's something that they do very carefully. The incisions and everything are made as if you were going to wake up the next day.
Yeah.
It's very respectful because they understand that there are a lot of lives involved and a lot of emotion that goes into it.
True.
You'll never wake up in a bathtub losing your kidneys.
Okay.
That's not
Oh,
gonna happen.
geez. Okay.
Sorry, but that's something that goes around that people
Really?
are just yes.
People think that?
People think that there's crazy rumors that people will just take stuff out of you and leave you. There's been movies out that.
Oh, yeah. I remember that a few years back.
I mean, but it's people that don't know or haven't had experience with it. Your mind can get carried away with things like that. And also, some people think that they're just giving their organs to someone who's sickly that, really is not going to have a good quality of life, so why would I give it to them anyway?
Yeah.
Well, I'm the reason that is definitely not true. I mean, you wouldn't know that I had a lung transplant if I didn't tell you.
Almost 5 years ago.
I mean, it works. And one person can save up to 8 lives.
Yeah.
With donating hearts and livers and kidneys and skin for burn victims, corneas for people with eye damage. I mean, it's amazing what people can give after they're not here anymore.
Right.
So.
Well, now after you had your surgery, you didn't go through a rejection, did you?
I had a few bouts of acute rejection.
What does that mean?
Well, it's kind of, they have to play around with your medications a bit. It's a delicate level, because you're immunocompromised. You have to have some of your immune system. Otherwise, you'd be the boy in the bubble. And then you can't have it too high up because then your body starts to really attack your new organs. So when that kind of happens, when your body's kind of in limbo, what can happen is your body starts to all of a sudden kind of really attack your organs, and you can get fevers, breathing problems, things like that. And usually you'll get high doses of steroids to kind of combat it and other treatments of that sort. Chronic rejection is kind of something that happens over time because your body kind of does wear away a bit.
Well, yeah, it would be.
Yeah.
It's going through a lot of changes.
Yeah. But the idea is with all the medication and all the treatments and all the, what you do, keeping yourself healthy, keeping up with your doctor's appointments, the risk of your lungs becoming, the risk of it deteriorating, you want to keep that off as long as you can.
Yeah.
So, I mean, the first successful one, double lung one, was done in 86. First CF was 88. First double lung, she lived 15 years.
Yeah.
Which, if you think about it, is pretty remarkable.
During that time, yeah.
During that time. And considering that the first successful one was done within my lifetime.
Right.
I mean, that's not a long time ago.
It's not a long time. Definitely
and they've just
not.
leaps and bounds with medication and how they do it. I mean, I'm cut from here to here. and you would never know. I mean,
Well, I mean, the incision is
it's a
very.
great. You've seen it.
I've seen it. Yeah, no, it's a great incision. If incisions
If you
can
have
be,
to have an, if
it's
you
a
need an
great right.
incision, it's a great
It's a
incision.
great incision. Now, I mean, this was not like clean cut, boom, okay.
No,
No, no.
no, the surgery was the easy part.
Yeah,
They used to say you're kind of trading one illness for another, because now you have to deal with, chance of rejection, low immune system. Um, I got a very bad case of this. They called, I forgot exactly. It was a type of pneumonia, and I was the sickest I'd ever been in my life. And that was
but
about a year and a half after the transplant.
well,
And
then
they
that.
think it was a reaction to one of the medications.
I mean, this young lady has been at death's door way too many times to count, and that one last time, you were right there. They had you in a coma.
Oh yeah, I had a little place setting at the table. That was for sure.
Yeah, no, I mean, she was right there. And the willpower she has, the strength. Give her 1 little ounce, 1 ounce of positive, 1 little gram, and she's going to pull through. And she did. And I remember you telling me the story that when you pulled through that, which, I mean, everybody was just, there was just no way. And she became the miracle baby, really, with
Oh,
with the
well.
strength and willpower. But I remember you telling me a story that you got out of your bed and you sat in a chair.
Oh, well, actually, that was before the transplant. That was when everything was kind of, I just kept getting hit over and over. It was like my lung collapsed, then they gave me the wrong medication, and I ended up going into respiratory. It was very bizarre. Um, yeah,
But you do remember the
I
story.
remember I got up out of my ICU bed because I was able to at that point, and just kind of talking to the bed because I realized there was a clock on the wall in back of the bed. I'm like, well, you can't see it from my bed. I kind of realized that that's kind of for people to look at it and, helps call time of death, things like that, if. And I finally sat there and I was like, all right, I was off the ventilator. I took the oxygen thing off just sitting there. I decided it would be normal for
For a
1
minute,
minute, for a
yeah.
minute. And I said, all right, I just have to resolve myself to the fact that this is just going to be my life for this time period. So I said, all right, put me back in the ICU as many times as you need to. Put me on the ventilator as many times as you need to. Let's just do this. I was like, because I'm just going to keep going. Because I was getting so tired, but it was because I was saying kind of like, why me?
Yeah.
And I'm like, you know what, this is me. This is me, that's it. So if I just say, okay, fine, I'm going to tap out on complaining, and I'm going to say, you know what, keep it coming.
I can
And
take it.
I'm going to just keep going.
Yeah.
And if for some reason, it wins, at least I put the effort in.
Yeah.
I'm not going to give up,
And you didn't.
No.
Not once.
No. But I mean, I was lucky because, as you said before, my parents, very strong individuals. My family was very supportive.
Yes.
The doctors and nurses I had were amazing.
Yes.
So,
Definitely.
and the friends I have were very supportive. So it was, they're the reason that, you get this strength, this reason to
Yeah.
want to do stuff, want
Exactly.
to be
She,
alive.
she kept telling me, she said, if you come to Seattle, I know I'm going to die.
Oh, absolutely. I said, if I see you, I know that's it.
And so
That's it. That's it. I'm a
that's
goner.
it. I mean, because I don't fly anymore. I don't do any of that. And she knew that if I showed up. And so
Not good. This
it's
is not
not
good.
good. So, of course, I never wanted that in your mind. And
Although she thought about it.
I did think about it. But I also didn't want to take that chance because she knows me too well and she wouldn't believe me. Um,
I would think I'd completely lost it, and I'd probably think I was already gone already, and I just imagined you.
right, exactly. So, of course, we talked on the phone a lot when she could
Yes.
talk.
When I could talk.
When she could talk, I mean, but this was I mean, mentally, physically, this is a hard road.
It was a hard road. And there were times where I thought maybe there's a story that my ex-husband, would tell me that he thought I was in so much pain it would be better if I know it sounds bad, but you have to sit at the time when you see someone you love, you wonder
Right.
if it's too much for them, if they
Mm-hmm.
should just let go.
Yeah.
I told my father this, and my father wasn't upset, but he looked at me and he said, life is always better, because once you die, that's it, you know. There's no chance to get better. There's no chance to make your life better.
Mm-hmm.
Um, so as hard as the road is, as many dips, potholes, crazy people driving on it, I'd rather be on the road.
Yeah. Yeah.
I don't care what the condition the road is in. The
Right.
road is out, whatever.
We'll
Just
take a
keep me on.
detour.
Just keep me on that road.
Yeah.
So
No, I mean, now, since all of this has come about, and your body has gone through this, and she's celebrating her 5th year.
yeah, it was a few weeks ago, on the 24th of April.
Yeah, 5 years survivor, and that's pretty remarkable.
Yeah, it's a big deal because the first 5 years are supposed to be kind of the dodgy times, um,
I mean,
and
the first time she got on a plane to go home for Christmas,
it was Easter.
Easter,
I surprised everybody.
you did, and I was a wreck because I kept thinking,
I told you I was going home.
yeah, well, I knew you were coming. I don't know if you told me, but I knew, and I'm thinking, oh my God, her immune system is so low, and planes are notorious for germ factories, and it's just this thing in my head, but she made it.
I didn't go without telling the doctors. The doctors all knew.
That's
But
true.
yeah, I went and I hadn't been home for 2 years. Flew to JFK, rented a car. Me and my dog drove to my dad's house. Stepmother came outside, started crying. My father came home from work, and there I am.
Yep,
And
there you were.
there I was.
But it was just, I mean, she would push the envelope, push it. And the immune system was all that was ever on my mind. But you kind of
Which
got
really,
through
I
it.
got to tell you, which really hasn't been too much of a problem,
Not now.
sick-wise. I mean, more people have been more sick in my family than I have,
Right, right.
which I find kind of funny
Well, that's
and
true.
ironic.
Yeah, well, yeah. But no, I mean, now, what would you tell a young girl out there, maybe 12 years old? What would you tell our audience if they were just diagnosed or getting ready for surgery or waiting for lungs?
Depending on your situation, depending on what you've gone through.
Yeah.
I mean, if you're on a transplant list, you've already kind of gone through a little bit of a rough patch. It's not like you're healthy and then you wake up the next day and oh, I need lungs now. You've gone through your paces to get to that point.
Hmm.
When I first heard that I needed lungs, I didn't know enough about it. I thought that I was going to die, that this was just I thought this was like patchwork. I remember lying in the hospital bed and telling my husband at the time, I wish we had more time together. It was very emotional. But then I had the doctor start talking to me. I had the surgeon come in and talk to me, and they were like, this is not the last resort option. This isn't something that we do so that, you can just get through another few years of life. They really do it hoping that you can have a very full life. Now, I guess you could say you feel like you're on borrowed time but I mean, the lungs I had before, first of all, I wasn't going to make it the year.
Yeah.
So I've had people say, "Oh, you're so brave," and I'm like, "Well, when the
You
other
had no
choice,
choice.
when the other choice is or death."
Yeah. Yeah, let's.
Um, but just do your research. Be realistic about it, but also be as positive as you can be.
Yeah.
Do what you can. To put as many things in the plus column as possible. Um, like I had to make sure that one of the big things for me having CF, I couldn't weigh less than I got very, very skinny.
I know you did.
I'm not big now, but I was skinnier then. And if I lost so much weight, they couldn't do the surgery.
Right.
So it was very important to kind of make sure that was all right. I think realize that you're going to have days where you're just going to sit in your bed and start crying.
Mm-hmm.
And you're going to
Because
start.
you don't feel good.
You don't feel good. Now you're waiting. You're playing a waiting game of what's going to come first.
And I would think it would be more like, are they really going to come? am I really going to make it?
There can be that, thought, and sometimes it hits you. I think the more time, though, that I waited for it, um, I just took it day by day. If I went down the road too much, which, look, you're going to do it. There's going to be times that you do it.
Right.
But you can't live your life that way because you'll get nothing done.
Right.
You'll get nothing done. You might as well just sit in the corner and suck your thumb all day, basically. But like for me, as I've told you before, it's only exhausting if when I tell it to people.
Yeah.
For me, even though I had the oxygen, I had a dog.
Yeah.
Most days I woke up going, like normal people, oh, I gotta take the dog out. Oh
Yeah.
my God, it's raining. Oh, I gotta shower. Oh, I gotta do this. That was most of my days were normal, but I just had this overhang of waiting for a call.
Right.
Just try to enjoy the normalcy, the little things. I still get a kick out that if the elevator's out, I have to take the stairs, I can.
Yeah.
As silly as it sounds. The dog gets off the leash and starts running after a squirrel. I can chase him.
Yeah.
You know.
When we lived in New York, and the audience knows I lived in a 5-flight walk-up. And
no elevator.
No elevator. And I could hear her at times coming up, breathing heavily. This is
Oh, it
all.
was terrible.
Oh,
It was terrible. I'd
yeah.
have to stop.
But it was exercise. You made it.
Barely sometimes.
Barely. Yeah, me too. I was smoking at the time.
You'd ring me up and 15 minutes later I'd show up at the door.
She'd show up at the door. But now, I don't hear you out of breath that much.
No, I don't cough.
You don't cough. No.
It was so bad that if I was in a department store with my friends and I coughed, they could just tell it was me by my cough.
Yeah.
If I was in a bathroom stall and I coughed, I'd hear Helena.
Yeah.
That's how bad it was.
Your cough was very
It
distinctive.
just felt like towards the end, before my transplant, a lot of my mental energy was focused on breathing. And afterwards, it was so easy for me to breathe, I thought I wasn't. Every so often, I'd have to take a deep breath in. Because I'm like, am I breathing? Is it working? Yeah, okay.
I remember you saying
Very weird.
when we got on the phone, you said, it's so weird to be able to breathe.
Yeah, because anybody with CF knows the cough. They know exactly what cough I'm talking about. And they know that feeling. They know there's this sleeping arrangement, which I still do out of comfort. It's like kind of like Indian style, and I kind of hunch over on pillows because it was the weight off my chest.
Right.
And I know I'm not the only CF person that's done that because I've had talks with people.
Right.
But there's just certain
certain things that
you do because you can't lie on your back because you feel like there's
a weight.
rock on. Yeah.
Yeah. Now, I had heard that CF patients, when you have CF, you can't be in the same room with other CF patients.
Yes, there are a few viruses or something that kind of can go between CF patients.
Okay.
It's not like if I happen to run into a CF patient, we'd immediately, fall on the ground.
No.
But like when I would go to the doctors and there was we'd be put in separate areas just to, there was a couple things, a pseudomonas infection, which is actually a common, it's on the table, but it happens to really like moist, dark places that, it thrives in a CF environment. So there were a few things that could be easily transported between two CF patients. So as more precaution, they usually put them in separate rooms. So usually when I went into a hospital room, I had my own room.
Right.
You would never have two CF people in the same room together, unless that's changed, which I doubt. So.
Wow. Been through a lot.
Yeah.
You're going to be 30 in October. I know.
But I don't look it apparently.
No, you don't.
No, actually,
No,
30,
you don't.
30 was always a big deal for me because, as I said before, growing up, that was the life expectancy
I know.
for 30. for 30. For CF people was 30.
Yeah, exactly.
So making it to 30 in my mind is kind of a, you know,
So
a
now
little
it's
thing.
at this point in your life, do you follow a certain diet? Do you follow any kind of a
Probably should a little bit
regiment?
more. No, I do meet with a dietitian every so often. They always monitor my weight, make sure that, things are going like that. Because I still have CF. My lungs will never have it, but I still have CF. So some CF patients have pancreatic problems. Some, it's really hard for them to keep weight on.
Yeah.
I was lucky enough I didn't really have any. Like I'm not on pancreatic enzymes, which is something that they usually have to be
Mm-hmm.
on. Uh, but I mean, you just have to remain healthy. The healthier your body is. But
The
don't get me
better,
wrong.
yeah.
I still, if I want a Big Mac, I'm gonna eat a Big Mac.
Oh yeah, yeah.
You know
I know that.
that.
I know that.
But I was never, I'm not a huge junk food eater
You never
person.
were.
No,
No.
not a big soda drinker. I mean, I go through phases, but
But you look wonderful, honey, and I am so
thank
proud of you.
thank you.
I mean, I know this was not an easy road.
And I know it wasn't an easy road for you,
No, but
watching your little Wahini go through all of
my
this.
little Wahini, I called her Wahini, and I never had, I never had children, and luckily I had you in my life.
Already paper trained.
She was paper trained. She would walk off the leash.
Heal very well.
Heal very well. Um, very lucky to have you in my life. Oh, we had our ups and downs. We had our arguments. I was so afraid of losing her. So afraid.
No, no, you and I definitely, we lived together at one point, and I left her at a furniture store here in Maine actually once. We won't get into it. That's for another show.
That's for another show. But I mean, we never really argued, but I just never wanted to argue with her. I never wanted to have a disagreement with you, which we did have disagreements, believe me.
And I had to tell her it's okay to argue with people you love because they'll just always be around,
Yeah.
which is
See,
true.
which I never knew that because that's not the way I grew up. So I always figured if you have a fight, it's over, it's done, that's it. They don't love you anymore, it's over.
Don't cover your mic.
Oh, don't cover my mic, right. But we've been through a lot. She did a lot of my trade shows for me. She modeled for me. I have tons of photographs of her.
So I see, I did have that life. I was able to do all that stuff.
She did. She did. I put
No.
her into trade shows. Her first show was Panasonic, major corporation.
That's right, it was.
And she said, "You're throwing me into the deep end
With no floaties.
with no floaties." And I did. And she did great. She did great. She's always been a people person. Um, and, I just can't be prouder of you. So
Well,
you're,
it's not like, I wanted to go through all of this so I could be, you know. I wish it was a lot easier to be proud of me for something,
no,
a
but,
little less strenuous.
no, 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 no. But I'm proud of you for thinking on your feet. I'm proud of you for being strong, logical at times that are needed.
I get that from my father.
I know Danny's so damn logical. Oy vey. But no, but really, I mean, you get that where, I mean, your mom was an outgoing person. She was,
Very strong. I saw her go through.
she was very strong.
That was one of the
Fran,
things I was always like, Mom had it worse. Mom had it worse. I gotta stop complaining.
yeah, I mean, she had
Breast cancer. She had breast
She had
cancer. It
breast cancer.
metastasized, and she didn't survive. But she was a mom to the end. She was.
Yeah, she was. I mean, she knew she was an amazing woman. But, I mean, you are who you are because of Fran, Danny,
Oh yeah, no,
and the whole family.
from everybody. I mean, and I
Yeah.
and I try to behave in a way in such, when everything's been happening, to think of them, and if
But,
people look at me, and I hope they think, wow, she must have come from
yeah,
a pretty awesome place to be, because I do like the person I'm becoming. I'm still growing. I think you always
well,
continue to.
but your life went on hold.
Yeah.
Your life went on hold. A lot of things happened. So, of course, you're kind of picking up again, you're kind of going.
And I'm
Um,
able to,
and you're able to.
you
That's
know.
the important thing. I mean, I feel that we are very lucky to have you in our lives because there was a point where I didn't know when I was going to lose you or anybody else.
Yeah, I was good at that for a while.
You were real good at that for a while. So she wanted to surprise me at this show in particular. Her uncle, James, she brought a photo of when you were how old?
I must have been 7-ish.
7-ish.
Probably right around the time I got diagnosed with CF.
Her uncle James and I and her, and I have a death grip on both of them. And this kind of formed my life for a good 20 years here. But she brought this in, so Uncle James was along with us too. But honey, our time is just about up here. And
It went like that.
see, and you were so nervous.
I really was. I was pacing the halls.
She was pacing the hall.
Well, just once, really.
Anyway, but honey, thank you so much for taking the time, for being on the show.
I'm so happy I was able to come on, and hopefully, if anybody out there sees this and is going through just not a transplant issue, just a health issue in general, and you're young, I mean, yes, it's gonna be crappy at times. It's just gonna happen. But if you resolve yourself, I'm convinced if you just resolve to your fact that you just keep going, you know,
Well, the alternative sucks, yeah.
yeah. I mean, the alternative it shouldn't even be an alternative.
Well, right. And now, if somebody wants, well, we have your,
My email address.
if you want to contact her with more questions, feel free to send an email to you.
Yeah, absolutely. There's absolutely no question that I feel
You can't
that I
answer.
can't. Well, that you should feel bad asking me about. I'm not. I'm very candid. I'm very open about everything that's happened to me. I've had other health issues besides the transplant.
Yeah.
Um, and I've pretty much been sick since I was little.
Yeah. So, feel free to contact her with questions. She's here to help. That's your gift
Well,
of what you've been through, taking away fear of young kids going through this now, adults even going through it.
just for them to see that it's possible, just not to limp through life.
You
That
don't have
not
to.
to
You don't
not
have
to
to.
survive, but to thrive in a life. After a health issue, after a transplant, after, you know.
You definitely can. So please feel free to contact her. Um, and if you would like her to come to your school or hospital to give a talk, that can happen too.
Yes, talking with other patients or parents or even doctors so they can get a patient's view.
A patient's view, that which is very important. So my dear, thank you so, so much for being on the show.
Thank you for having me, and I'm so glad I was able to come.
I am too, and we'll have you on the show again. We're going to check in with you. We're talking about doing a monthly Skype. So you would be right here,
Looking over your shoulder.
looking over my shoulder, as she always has done. And, but honey, thank you very much. And I want to thank everybody out there today for taking the time and watching our show. And we'll be back again. Bye-bye.